best anti-aging treatments that you can avail in 2025. There are so many options available now for anti-aging in-clinic treatments that a lot of you get confused which one is working in what way and how you can benefit them. Let me simplify them for you so that you can pick according to your skin the most beneficial treatment for you. Hello everyone, I'm Dr. Geeta Grewal and I'm a trained cosmetic surgeon, founder of Muses Wellness Clinic and 9M Skincare, and it is my passion to make you look beautiful, youthful, glowing and younger. Simplifying the anti-aging skincare. The first and foremost, the most essential part is skincare. That you have a morning and an evening consistent skincare routine. Build a consistent, regular skincare routine. Moisturization, SPF, cleaning, toning, all these steps have to be in place dedicatedly morning and evening. We have made video on skincare routine. You can look out for skincare routine, these videos, and if you have any more question on skincare, do ask us. After having a regimented regular skincare, introduce lasers. Make sure you don't introduce laser if you don't have a skincare, because that will cause damage to your skin and that will not benefit. So make sure you have a skincare in place and then introduce these laser and energy-based devices to take your skin health further. First and foremost is Rejuvenation Laser. This helps in toning, tightening, shrinking your pores, exfoliating, brightening and lightening your skin. You can have these treatments once in a while if you have like 10% collagen loss or you're having dull skin, but overall your skin health is good. They can be, I won't give an age bracket because I have seen patients in 30s having a 60-year-old skin and patient in their 50s having a 30-year-old skin. So I'm not giving an age bracket. I'm telling you about your skin health, about your skin condition, because genetics, stress, lifestyle, everything plays a huge role on skin health. So if you have just a little bit of dull skin, uneven skin, and you have like 10% of collagen loss, you can introduce Rejuvenation Laser. They will help in lightening, brightening, tightening your skin and keeping the aging effects like uneven skin tone, collagen loss, sagging, sinking of the skin at bay, and also avoiding pigmentation and open pores. So you will never reach that stage if you introduce a Rejuvenation Laser once in a while. What do I mean by once in a while? That is once in 2-3 months. You can take it as a regular maintenance for your skin. If you tan very quickly, you can add Pico or Q-Switch Laser. These lasers help in toning down the pigment cell. Indian skin has a lot of pigment cells. We have heavy, big pigment cells, and the pigment cells are very, very active. Any little bit of sun exposure, irritation, pollution, the melanocytes, they go in overdrive and they become overactive, laying more pigment and laying big pigment cells. So introduce a Pico or a Q-Switch Laser. This will tone down the pigment activity and it will help in giving you lighter and brighter skin. Not only letting the pigment down, but they also help in exfoliation, removing the dead cell, bleaching your fine hairs. So if you have fine hairs, you can't go for laser hair reduction. Don't go for bleaching, threading or waxing. Go for Pico and Q-Switch Laser that will bleach the fine hairs and you will have a flawless skin. Next energy device that you must introduce is a fractional CO2 and or a Erbium glass. They work on the chromophore for this laser is water, so they work in general in full skin health. They help in polishing your skin, off skin tone can be repaired, certain fine lines can be filled in, and they will help in tightening your skin. Till date, fractional CO2 is the gold standard for anti-aging, but make sure your doctor knows the skin type and the energy that has to be used. Otherwise, it can backfire by laying more pigment in your skin. So you have to be careful in the energy that you're taking. Always tell the doctor wherever you're taking your treatments to start at the least energy, and then you can top it up and increase the energy. And as you go to gym, you don't suddenly go and lift heavy weights. You always start with milder weights. So always start with low energy, and with every session you can step up the energy so that your skin can cope up and doesn't react, or you don't develop a rash, or you don't develop a pigmentation, reactionary inflammatory pigmentation to these energy based devices or lasers. Next treatment that I would highly recommend is a radiofrequency. The radiofrequency helps in boosting your collagen, it helps in stimulating the lymphatic, it helps in stimulating the microcirculation. So in all, it is a very good anti-aging treatment. Again, the whole emphasis is on using lesser energies, stimulating energies, and not energies that are going to burn your skin at the deeper levels. I have seen people doing radiofrequency at such a high dose that it depletes the skin of the good fat, the fat that nourishes the skin. So if the energy is too high, it will make your skin rubbery and lifeless and dull, and you will not have benefits. So make sure the energy is less, and you slowly step it up. Next energy-based device that you can certainly introduce is HIFU, that is high intensity focused ultrasound. It is an ultrasound device that you have heard for body diagnostic use, but this device, which is for face, has a focused energy, and it is of high intensity, and the focus is just under the skin, 3 mm, 2 mm, 4 mm, depending on the requirement. This helps in concentrating the energy in the upper layer and helps in tightening your skin and stimulating your skin. Again, the energy-based devices, always the rule is low energy so that you get stimulation and you don't get the side effect of burning your skin, the good fat under the skin, which is the risk factor in RF and HIFU. So we don't want to deplete the skin of the good essential ceramides and fats that help in nourishing and keeping the skin dewy and youthful. Whenever you're doing energy-based devices or any other lasers, your skin requirement for hydration goes up, and also the use of SPF is very important after any treatment. That's why I told you in the beginning that you need to have a good skincare regime to begin with, because the requirement of the skincare will go up after these energy-based treatments, be it microneedling, microchanneling, your HIFU, your RF, your lasers. The hydration requirement of the skin will go up. We've had patients who have got the microneedling RF done, and they had the stamping on the face for long. It was because of dehydration of the skin, and the post care was very poor. So you must hydrate your skin very well after the treatment, so that whatever stimulation of baby cell formation and collagen formation has come from these energy based devices, they are nourished, they are hydrated, and they reach to their full level. I hope you liked this video. I hope you learned something new today about your skincare and about anti-aging treatments that you can take in clinic. If you have any more questions about these treatments, we welcome you to ask them, and we'll make sure that we reply to your questions. Like and subscribe our videos, share it with the people whom you think will benefit from it, and stay safe till we meet again.